Urinary incontinence is a really common problem. It affects 1 out of 3 women in the United States, more common than high blood pressure, diabetes, but again, one of those topics that unfortunately women are embarrassed to talk about with their physicians or even with their girlfriends. I always tell women that any type of urinary leakage is not normal, but when should you seek help? When it starts to become bothersome for you. Obviously this isn't life-threatening or dangerous or cancerous, but it can really greatly affect a woman's quality of life.
When I went to Dr. Nguyen, my gynecologist recommended her. I had been experiencing some leakage and a few accidents that were becoming a regular problem for me. So it became a running joke in my household that whenever I crossed my legs, my husband knew that I was going to either laugh or cough or have a giant, huge sneeze, which would cause me to leak. And it got to be a nuisance on a daily basis. In addition to that, I wasn't able to run without leakage.
So surgical procedure is what we oftentimes call a mid-urethral sling, done as an outpatient procedure. Again, literally takes 10 minutes to do. You're in the morning, home by the afternoon, and back in work in a couple of days with very little pain or recovery involved. You're able to re-support the urethra. So oftentimes women start to leak with activity because as we've aged and we've had kids, the urethra, which is that tube that connects to the bladder to allow urine to exit your body, starts to lose support. And so the idea behind a sling is it's almost like a hammock to re-support the urethra so that now with any kind of activity such as coughing, sneezing, straining, that urethra is held up. It doesn't fall and cause leakage.
The minute that I woke up from surgery, I knew immediately that life was changed. I felt so much better and went and got on the treadmill and started running, and I was like, wow, this is so great. I can't believe it. I thought I was alone in this, and I think before I just thought I could deal with it. I hope that other young women understand that this is not just an issue as you get older, but it can be resolved when you're younger as well.